جيهان على دعوة الحضور والمشاركة في سيشن ال AI. شكرا دكتورة هبة على البرزنتيشن الجميل. أحب أقدم دكتور مروة خالد Assistant Lecturer of Radio Diagnosis, Faculty of Medicine, Benha University and AI in Breast Screening. تفضلي.
Our talk today about artificial intelligence in breast screening program presented by Dr. Marwa Khaled under supervision of Prof. Dr. Hisham al-Sheikh. So this is our agenda today. And first we will talk about facts about breast cancer. Breast cancer, there is a new cases of breast cancer discovered every year. 1 in 8 women will develop breast cancer in her lifetime. Breast cancer considered about 30% of cancer in women, and it is the most common cancer diagnosis for women in United States. About 85% of diagnoses occur in women with no family history. So what is the importance of breast screening? Screening helps to detect breast cancer in early stages, reducing mortality rates. The common methods used are mammography, ultrasound, and MRI. And early detection leading to a 95% 5-year survival compared to the late detection. So the screening limitations are a high false positive and false negative rates, variability in radiologist interpretations, and overdiagnosis of the non-threatening lesions. And this leads to increase the patient anxiety, unnecessary biopsies, and misdiagnosis. And this is a picture of the normal workflow about the breast screening. First, the patient undergo registration, and then mammogram, and then patient will need ultrasound or MRI according to the doctor, and doctor may need another follow-up or another investigation, and then he done a diagnosis. What is artificial intelligence? Artificial intelligence is the ability of a computer to imitate human behavior, for example, to learn or to act. AI developers train computers to recognize patterns in large amount of data, then begin evaluate new data on its own and start making predictions. How AI works: to train an AI to read mammograms, technician input information from hundreds of thousands of mammograms. As the mammogram exposed to more images of mammograms, it can learn over time, and what is called machine learning. AI detects pixel level changes in tissue invisible to the human eye, and then the AI software create a mathematical representation about what a normal mammogram look like and what a mammogram with a cancer look like. So then the AI check each image against the standards that we give and differentiate what's normal from what's not, and the accuracy depend on the frequency of the correct image predictions. So some cases, there's a 62-year-old patient had a BI-RAD 5 lesion on the upper outer quadrant of the left breast, showing an irregular density and distortion, and AI system successfully flagging the lesion here in the white circle, which show a true positive result. Another case of a 59-year-old patient with a BI-RAD 5 lesion shows speculated mass lesion at the 12 o'clock of the left breast. AI system didn't flag the lesion. That is a false negative result for the AI. Another case of a 67-year-old full-field digital mammographic view. AI highlighted a lesion and gave it a high score about 85, but this mammogram undergo read by 2 readers of radiologists, and it was only vascular calcification, which is not suspicious for breast cancer, which is a false positive result for an AI. Another case for a 52-year-old patient was diagnosed with BI-RAD 5 lesion, irregular mass on the upper inner quadrant of the right breast. The AI system successfully flagging the lesion here in the white circle, and that is a true positive result. So artificial intelligence can integrate in our workflow for speeding up the workflow, decrease our diagnostic errors, and increase our productivity. How artificial intelligence can integrate in our workflow? The standard double reading, this is the standard where there is 2 readers, and if there is mismatch, a 3rd reader will interpret the images. And the first scenario, that the AI will replace the second reader, and if there is a mismatch, a third reader will interpret an image. Another scenario that is concurrent reading with the AI, with the first two readers and the third reader. Another scenario where the AI can rule out all the low-risk cases and the high-risk cases will be interpreted by the radiologist. So the radiologist interpret the mammograms according to the BI-RAD system. It describes mass, asymmetry, distortion, or calcification, and the AI system can more specify in breast parenchymal density, lesion detection, lesion characterization, and giving a lesion a score and then final assessment. So here a picture that the AI can mark a calcification, mark the mass, and giving each a score. There is an AI tool that can predict lesion who are likely malignant, giving it a red heat map, or likely benign, giving it a green heat map, which aid the radiologist in the diagnosis of breast cancer. A case of a 70-year-old patient came with palpable left breast mass. A digital mammography revealed a hyperdense mass with irregular margin at the upper outer quadrant of the left breast and a few ice-dense lesions with obscured margin and the red arrows. The AI highlighted the same lesion, but it highlighted more lesions that are suspicious than the mammography that revealed that the AI can detect more suspicious lesions than mammography. Another case of a 50-year-old female patient presented with the right breast lump. Digital mammography showed a hyperdense mass at the upper outer quadrant of the right breast and the red circle and a pathological lymph node, the red arrow. The AI highlighted the both lesions, but it gave a low risk for the mass, about 44%, and the pathology detected is invasive duct carcinoma, which is that in this case AI couldn't detect the risk of malignancy. How could AI improve the breast cancer detection? It can, according to first, identifying cancer earlier. This is a case that the mammogram and the algorithm identified a high risk 4 years before the cancer was diagnosed. Second, can reduce false alarm, that a false positive result occurs when the radiologist detect an abnormal finding on mammogram that doesn't ultimately prove to be a cancer. Third, preventing unnecessary biopsies. There is a new AI tool called a BRISC, Intelligent Augmented Breast Cancer Risk Calculator, that show good result in detecting flagged lesion by doctors to be benign or cancerous. Fourth, predicting cancer risk. A study published at June 2023 found that the AI estimate a woman's 5-year risk of developing invasive breast cancer according to the woman's age, her family history and race, and the breast density, and any history of benign breast biopsies. So another benefit of AI, that the AI can add in the reading priority indicator that flag the most concerning cases at the time of examination, so the radiologist can choose to read those cases immediately. Some cases from literature. Here a mammogram of a 49-year-old woman showing a small hyperdense mass with a microcalcification at the right side. AI detected the lesion, gave it a red heat map, and abnormal score about 96%, which proved by the pathology to be invasive lobular carcinoma. Another case of a 60-year-old female patient, left breast upper outer quadrant, show a focal area of high density and distortion at the blue arrow, and the AI put a hot heat map and give it a score about 91%, which proved by pathology to be invasive duct carcinoma. Another case, this a case that a cancer missed by the AI system. It was a 7 millimeter speculated mass, which was categorized by the AI a low score about 3, but biopsy revealed that it is invasive tubular carcinoma. Another case of a 57-year-old, a full field digital mammography, AI marked a lesion and give it a high score about 89. And the same finding by the radiologist, and it revealed to be invasive carcinoma. A 62-year-old female patient, The AI highlight a lesion at the full field digital mammography, and the lesion detected to be invasive duct carcinoma. So the last studies show that the AI can detect cancer with a 72.3% sensitivity and a 92.8% specificity when incorporated with the screening workflow. This benefits when using AI as the second reader in our workflow. So radiologists can be more specified in physician-patient interaction, physician consultation, and radiology pathology correlation. However, AI specify in cancer risk assessment, workflow triage, image enhancement, and both the radiologist and the AI can interpret to evaluate cancer detection, precedency, and the image quality. Here are some papers that show that the AI detected high sensitivity and specificity in detection of a screening mammogram of cancer breast that published at 2024 this year. And another paper that the AI could rule out the normal mammogram. And another paper about artificial intelligence reducing the interval cancer rate in mammography screening. And the famous question, will AI replace radiologists? No, AI will not replace radiologists, rather it will help to make more accurate readings and manage the workflow. We have the radiologist in the driver's seat as the human element that we'll never have. Conclusion, AI have the ability to assist radiologists, improve diagnostic abilities, and improve our workflow. And thank you.
ميرسي دكتورة مروة.